I'm doing great.
I would feel like I should call you Dr. Coffman because if somebody's just listening to this in the background and hear me asking Alan for medical advice, they're going to think it's
Yes.
my husband. And that would probably not be the most trustworthy source. I love him and he's very
Yes.
smart, but not a physician.
He
So
can speak with authority. He's good at doing
he
that.
can. So look, thank you for taking time today. You're not seeing patients today, I take it?
No, it's my administrative day, and I just got a full cup of coffee. So once it's done, we're done talking.
Oh, goodness. I'm usually gauged by how long it takes somebody to get through a cup of caffeine. It's like a double dose when you're talking to me. All right, well, good. So, well, I have, just a few questions. And, I have 3 kids. Our kids are about the same age as your 2 girls and your youngest. And I don't know. I'm tired of Googling. I'm tired of just relying on haphazard reports. And this is not, anything to say about the different news media. And I try to really listen to everything and read everything. But I just thought you're such a trusted pediatrician in Chattanooga. And I just thought, why not go to the source? And I want to stipulate, since you're not our pediatrician, right? I'm not bypassing any of the usual chains of command. Just thought I'd go to you directly. How's that work?
Well, and I think it is hard because it's so new. The information changes every day. It's so hard to stay on top of what it all means. And then I think it's impacted almost every aspect of our life. And so you have all these new questions that come up as you realize, like, oh my gosh, this changes how I interact with my parents or how I interact with my friends and or school or sports. And so I think everybody's in that same place.
Well, good. Well, and I love this. So I've technically never done Facebook Live. I've done podcasting and TV and radio. This is new for me. And I'm seeing that we have lots of people who are already chiming in. If you have a question, post it here. We'll try to get to it. Again, I only have a cup of coffee to get through this. So if we don't get to it now, Dr. Coffman and I are planning to do this at least, twice a week, and we'll see how that goes. Here, look. So this is real time, right? So I literally just got back from Costco today. I try to limit my shopping. I'm the designated shopper in my family. I try to limit it to once a week. Costco is where I go because we have 3 teenage boys and my husband, and they eat that within at least 4 to 5 days. So I came with my newly crafted mask. Look at this.
Oh, that's nice.
You like, yeah. You've got yours handy.
I got mine too with goatee.
I like. You have a built-in goatee.
Yes.
Yeah, there's a Costco checkout guy who had a beard. I didn't know if it was like taped onto it. I'm thinking that could be cool too. But this is, certainly the newest accessory of our time. I'm also wondering, with a senior in high school, is this the new graduation gift of 2020?
Yes.
And I say that sort of in jest, but I'm wearing a mask. I see 90% of the other people out there wearing a mask. Costco announced today, as we were in line, they will not allow people in the store after Monday without some sort of covering on their face, whether it be a bandana. What do you recommend in terms of wearing masks? Because that also changes on an hourly basis. And also with our kids, right? I have teenagers, but what about people who have littles, right? Do you recommend that too?
Yeah, so that's a great question. And when we're talking about almost every day, almost every visit in the office, my marketing friends are so excited about these masks because it's like the branding opportunity of 2020, like you were saying. And you need to be careful because there are a lot of scams on Facebook and Instagram where they're not real companies that are making these masks. The only reason that the general public should be wearing masks is to protect everyone else. So when you look at a cloth mask, it's not, you don't wear it to protect yourself. What you're actually doing is, if you perhaps were asymptomatic and you're shedding the virus, as you are producing droplets that have the virus in it, that mask stops those and decreases the amount you're going to be contaminating everywhere you go. So as you're walking around Costco, if you didn't have the mask, you would be applying that to the floor and all the common surfaces. And so common surfaces is a big focus. So as we're looking at reducing coronavirus, surfaces that we share, so the tongs in the salad bar and door handles and the floor, those are all places that are going to be high risk for contamination. And masks help everyone not contaminate those common surfaces. And a cloth mask is fine. When you look at health professionals, they're wearing surgical masks and they're wearing N95 masks. Those help protect the person that's wearing them. And frankly, we don't have enough for everyone to be wearing those. So medical professionals need those. I think we're going to see dentists as they go back to work and dental hygienists are going to need those. Retail folks that are interacting with people all day long, they're going to need those. And so you need to be responsible about where those go. And so I think everyone should be wearing a cloth mask. There's several really good resources that we're going to put the links in the chat afterwards about how to make one for yourself. I get a
Yep.
lot of questions about, should I filter it? Should I put coffee filter? Should I put something else in there? If it filters out the coronavirus, it's probably too small for you to be able to breathe. And so it's not going to be a very comfortable mask that you're going to be able to wear very long if it's properly filtering for coronavirus. The other thing is that coronavirus doesn't survive in dry cloth. And so a lot of people will have enough that they can wash them. So when you get home, you just throw it in the washing machine. You can also put it in a contained place, like in a brown paper bag, for 3 days, and it'll dry out, and that'll kill any coronavirus that's on your mask. And so if you're adding a coffee filter, that is another place you can hold moisture, and that the coronavirus can stay longer.
All right, I'm glad you said that because my mask literally has this little opening, and you're supposed to put a coffee filter in. Now I think maybe I'll just store M&Ms or something,
Or
you
your
know,
credit
like
card.
snacks. My credit card.
Yeah.
That's a great idea. Then I don't even have. It's like I'm totally like hands-free, right?
Yeah, there
Because
you go.
I see people. I'm really cognizant. Your phone. I know phones are also sort of like
A
the
very
hot
common
spot.
surface. Yes.
Yeah. Do I need to? I've got my Clorox wipes back. Should I be wiping off my phone too after I go out or once a day? What does that look like?
Yeah, so coronavirus is shed in stool. So cleaning it after you go to the bathroom, or not taking it with you when you go to the bathroom. Realizing when you return home. So as you come home and you think, I need to wash my hands, you also need to clean your phone. A lot of people are wearing gloves right now, which doesn't make a lot of sense for the typical person. Does a couple things. It gives you false sense of confidence. So then you begin touching your face with your gloves, which is not good. Most people don't know how to use gloves appropriately if you haven't been trained in sterile technique. You just don't think about how am I doing this, and then you tend to touch common surfaces like your glasses or your cell phone or your wallet or your credit cards or your keys with gloves. And so and also medical professionals need gloves right now. So that's kind of an addendum to that.
All right. So like you, I have, kid in college and kid in high school. I have two in high school, and then you've got a smaller one, but we've got the gamut, right? And at this
Yes.
point, we have been sheltering in place. I think I have it up on the screen. This is legitimately day 44
Yeah.
for our family, right? Not that I'm counting up or down. I don't know where to stop. But I'm starting to get questions from especially our teens, right? Our older teens of what is the safe way for them to re-entry into the social world? So
Yeah.
remain socially distanced, but also just to see people. And I feel like if I don't allow a little bit of flexibility, they're going to go, crazy. And I'll tell you, like full disclosure, we had a 6 degree of separation or, social distancing with some of our neighbors a week or two ago in our driveway, which is a very long circular driveway. And we were all able to bring chairs and sit far apart. And that felt okay to me. But also that sets a tone for our children. And I
Right.
realize that if I can do it, right, it's not do as I say, not as I do. It's
Correct.
hopefully do as I say and as I do. So was that a good example to set? And how do we start to reintegrate especially our teens and tweens into that society?
Yeah. Well, and also like every kid's different. So, I have 2 rule followers that, do it. And I have another one that you give an inch is going to take a mile. And so, literally I trusted to follow the rules and to be smart about it. The other one I couldn't. And so everybody, I had to kind of pull it all back. And again, like you said, watching what I do, because if I go do something and I know what I'm doing, she's going to lose her mind. And so I think, you have to be cognizant of each kid as we go along. The other concept, so we talked about common surfaces. You want to think about dwell time. So there's a lot of new studies that are coming out showing that most people get this by being in close proximity with others for a significant amount of time. So we live together, our desks are beside each other at school or work, we ride on the train together, we sit beside each other at a religious service, we were with each other at a graduation. That's going to be the kind of thing where we see this transmitting. And so as you start to think about like, how do we do life? Like, this is not working what I'm doing right now, and I may need to be doing this for the next 18 months, 2 years. How do I do that? So that would be my approach.
Sorry, I just stopped breathing for a little bit when you said 18 months to 2 years.
Well, and I did it purposely just because we have to be talking about that. So many people are approaching this as a sprint. Like I can do this for a couple weeks, but it's going to be longer than that. And as you're kind of figuring out what do we do. So when this first broke and we were all had a lot of social interaction, it was actually appropriate for the entire family to be social distancing from each other. So we had
Wow.
all been out doing different things. And as you came back, as you said, okay, the five of us are going to be in the house together, the six of us, you need to social distance in that kind of setting. And then after 2 weeks, after 14 days, you knew that we don't have it. And so then you can start loosening up what we do at home. And so now we're starting to say, okay, well, grandma has been social distancing and we take her groceries to her and leave them in the garage. She hasn't been hanging out with anyone. She doesn't have any symptoms. Pretty low risk to bring her back into your rotation. So you go over there and you hang out and she comes over. And so as you look at friends that you're in your social group, your ability to do that is going to be limited by who is the worst at social distancing in your social group. And so,
Right.
making decisions about that. A next door neighbor where, your families get along really well, they're social distancing. The kids are the same age. They're all going to be able to handle this. We can do it in a way that doesn't rub it in everybody else in the neighborhood's family where, all six of our kids are out in the street, which is going to invite every other kid on the street to come out and play with them. You want to, that would be my approach as you move forward. And I think, the smart way as we start to look at how do we do our faith and how do we get back and, go to church or synagogue or, however we do this, it needs to start in that same kind of way. So, our three favorite couples at church, we've all been socially distancing and we're all being very cognizant of this. And so we're going to start meeting together and watching our church's live stream together so we can start to build some of that community back. That's going to be the right approach to take to all this. And the more you're limiting common surfaces with your kids' play. So, a bunch of boys getting on their bikes and riding around the neighborhood,
Right.
low risk. A bunch of boys getting on a trampoline and jumping and yelling and screaming as hard as they can, pretty high risk. And so I would really look at like what are the practices of this other group that we're looking to bring into our family, and then what are the common surfaces that we're introducing and what they're doing.
So since we have three teenage boys, I want to make the sports analogy. What you're saying is if they are going to go out socially and play golf, right? And there's four of them all the time who've all been maintaining, this sheltering in place versus if my kids go out and play basketball, pick up basketball with 10 kids they either know or don't know, and everyone is touching the ball. Those are two different social situations, right?
Correct.
And the first one's better.
Yes. And so, like they're going to go to the club, they're going to go play, they're going to come right back, and we're not going to stop at Sonic and meet 12 other friends or stop at a friend's house and watch a movie and all eat out of the same popcorn bowl. Those are the things that you're going to have to really nail with kids as we go forward. And I think specifically because I get so much about teens and tweens, like how in the world are we going to do this?
Yeah.
And I think, one, it's going to force us either to become really good parents or really terrible parents. Like there's no like being an average parent in the middle of coronavirus. So
Right.
you either give up and say, I'm going to let them do their thing, or you're going to have to take a beating, and set some boundaries. And so one, remember that, if you're between the ages of 11 and, 18 for girls and 25 for boys, most of those people are really age appropriately narcissistic. So I really play to their, looking at themselves. So, take care of yourself and think about like, why would they want to take care of themselves? So, if they live for playing golf or if they live for, whatever, I really play that into how we're going to approach this and really try to have those conversations in light of what their interests are, what's important to them, what do they want to keep doing. So if they just can't wait to get back to college in the fall, saying, you going to this big get together with all your friends in June where 150 people are going to be meeting up and all cramming into a room and yelling and dancing, that's not going to help that. And so I think as you look at your children, I really try to play to that part of it.
All right. Well, I definitely I know we're going to have these conversations more often. I think the next one, I definitely want to address a few things you talked about, which is the likelihood of these kids going back to school, any school in the fall. And more pressing is summer camp, either day camp or sleepaway camp. So let's save that for next time. Two things just to end with. One, a friend of mine who knew we were talking today asked me to ask you about well visits, right? Her kids are due for their well visits this week. Her inclination is to go because they have some very, they are safeguarding all of their patients in very specific ways. Do you recommend that we take our kids if they have a well visit this week, if our pediatrician is seeing patients? And two, on a more pressing issue, Mother's Day, right? I mean, we've talked about all this social distancing. What do you recommend? I know you sort of gave a background, but if we have parents who live a few hours away, a few miles away, what do you recommend that will be a safe way for us to all celebrate?
Yeah, great questions. So on the well visits, the president of the American Academy of Pediatrics actually came out and said it's imperative that we continue well visits right now. Part of it is that your family has never experienced anything as far as a stressor on your family as the magnitude of coronavirus. So touching base and doing an assessment with your trusted, family doctor or pediatrician is a good way just to check in, like, are we doing okay? The other thing is we don't want to be talking about in 6 months a measles outbreak because the measles vaccination rate has dropped off, or we're starting to see other preventable vaccine disease, other vaccine preventable diseases pop up because our vaccination rates are dropping. We have done a ton of work at our office, as every pediatrician in town, in regards to making things as safe as possible. I was joking earlier that this is probably the safest time in human history to go to the doctor because, most of the ill stuff we're managing via telemedicine in our office. And so, and then I think there's not as many people going to the doctor. So at our office, we check in, from your car, and then you come straight in. You don't talk to anybody. You go straight to the room. The only person you're interacting with is the nurse and the doctor. And so there's a lot, and then we clean each room between each visit. So I would say that's a very safe thing to do right now. In regards to Mother's Day, I think looking at kind of what are the risks. So the less maintained in regards to your approach to coronavirus person in your family is how risky that is going to be. And so if mom lives by herself and has been quarantined and you guys have too, and nobody's having symptoms, that's a pretty low risk thing to go spend time together. If you have some members in your family who just are either in denial or don't think about this kind of stuff or busy or whatever, getting together, if everyone's masked up and we're sitting 6 feet apart and we visit for a little bit, I wouldn't want to eat in that situation where my mask is off and my food's there and I'm putting stuff in my mouth that other people in a closed room. There's good evidence that coronavirus and droplets can spread pretty far. And if you're moving stuff back and forth to the table, and then that much exposure to yourself is pretty high risk right now. Doing things outside is less risky. And so, going and sitting in a park and, and talking and visiting, if kids are running around and screaming, that's going to generate more droplets. I would be careful again about eating in those kind of situations. But the family getting together and going for a hike, those kind of things I think would be very low risk right now if everyone's been healthy.
Okay, good. Well, look, I know we've gotten a lot of more questions. This is, questions generate questions. Lindsay, we're going to get to your question next time about the impact on school age kids. It's a great one. Barbara, I'm right with you. The school and camp, enigma is the one that's pressing on our minds personally. And Maggie, we really do like the littles. We don't want to forget the littles and toddlers and our first responders and people who are still working on a daily basis. And we know the risk factors there have been heightened, but we need those people out there. So Dr. Coffman, thank you for letting me call you.
Yeah, well, and I would just stress that this is changing,
Yeah.
and so as you plan for the future, like plan for weddings and plan for graduations and plan for football, may not happen. And so I think with camps and things, being open to those, I think kids need that hope that they're looking forward to stuff. Yeah. And so I think plan for things, but realize I would not invest a large amount of capital in things for the future.
And to your point before, right? Like, don't let, perfect be the enemy of good, right, or even okay, or even a television set, right? Mm-hmm. Like, everybody's so hard on themselves. I think the two words we've been spreading is grace and gratitude, right? Yeah. We're so thankful for the things that we have right now. And we got to give not only each other, right, but ourselves room
Correct.
for mistakes, and the grace to be able to say tomorrow is a new day, and to take it one day at a time. But hearing from someone like you, I can tell you, it's already like, given me a breath, and I can feel my anxiety level decreasing after the PTSD I had at Costco. So
Well, and I appreciate you taking the time to do this. It's nice to just have a place where we can all talk about it.
yeah.
I get to do this kind of one-on-one every day, 20, 30 times, and it's nice to be able to amplify that a little bit. So I appreciate you
Well,
doing that.
good. Well, and I know since things are changing so quickly, we hadn't really discussed when we're going to do it again. But if you follow us on Facebook, and I know we've set up a Twitter and Instagram account too, we're going to make sure and let you know as soon as possible the next time Dr. Coffman lets me call him, so we can continue this conversation. We're going to try to do it as often as we can, but in short bits that are easily consumable. And for people who may not be tuned in on Facebook, we're also going to try to start this and repeat it on a YouTube channel. So as much information as we can get, with people who are just willing to have these sort of critical and candid conversations. I so appreciate you. Thanks, Dr.
Same
Kaufman.
here also. Thank you.
Hey, have a good day.
You too.